not just about clinical documentation, it's not just about coding, but how those relationships work together for the greater good of our patients that we ultimately serve.
Hi everyone, and welcome to Operator Insights. I'm Julie Roberts, and today we're joined by Alison Bowlick from our Clinical Documentation Improvement Group here at Ensemble. Welcome, Alison, and thanks for taking some time to talk to us today.
Thank you, Julie. Glad to be here.
All right, so super important question for maybe those who are watching us and wanting to learn more about healthcare space. Can you explain to us what clinical documentation is and what it supports here at Ensemble?
Sure. Clinical documentation improvement is a select department within revenue cycle that really works with the providers on their documentation on inpatient records. To explain that a little bit further, we really help decipher and work with the providers in making sure the necessary documentation is on the records in order for it to be codable, billable, reimbursable, and that then translates into quality measures as well as additional reimbursement for the facilities.
Well, that's very important to us, absolutely, and to our clients, I'm sure, who are watching. Can you describe to us, as you have built this program out, what have you been focusing on the most, right? What's been your process of designing best practice model for our clients and beyond?
Sure. I think standardization is first and foremost the most important. Working across many different facilities and healthcare systems, it's easy to become siloed and to fall into doing your own thing. So really making sure that the processes make sense, that they can be followed regardless of what software they're on, regardless of what provider types you're working with, regardless of what type of staff you have as well. That's really important. Also then expanding on then the education. There's a lot of education that goes into documentation. It's not just you learn it once and you forget about it. Healthcare is evolving. Diagnosis and disease process treatments and procedures are continuing to evolve as well. So our team has to stay on top of that to make sure that the documentation is reflective of what's being done for that patient that comes into the facility.
Sure. How do you stay on top of those things, right? With the fast pace of healthcare and the change management that's involved, how do you keep your team on track with those trends?
Sure. So education is first and foremost, and there's a variety of different facets that we get that education from. Whether it's just out on the internet, working with health information management systems and those types of things. Our vendors additionally help us with intern education. We really partner with the coding department as well, so they help us with that education that we may be, as clinicians, kind of a bit behind our steps on.
How do you foster that relationship with the medical records coding group area, that HIM team? What is your approach to making sure that there's a seamless teamwork structure in that space?
Sure, it's a continual work in progress, but having that open dialogue and communication, knowing who your go-tos are, explaining how important those relationships are for the success of revenue cycle as a whole. So it's not just about clinical documentation, it's not just about coding, but how those relationships work together for the greater good of our patients that we ultimately serve.
When you were talking, it made me wonder, as you have built this program out and designed it, right, based on best practice, what kind of nurses are you looking for to do this work? And how do you get them ready to do this work from the clinical environment?
Absolutely. It's so very different than being at the bedside.
Sure.
And so the things that we look for in the nurses that we onboard or bring into the program have that good, solid clinical background. You know, what kind of departments did they work for? What is their level of understanding as far as disease processes and that sort of thing. So a good, solid nursing foundation, critical thinking skills, disease process knowledge, working with providers is all essential in moving forward as a clinical documentation specialist. Really being open to continual learning, like we touched on a bit earlier. It's not set one and done kind of thing. You have to be open to continuously learn, advance your knowledge base, work with providers on a different level than you did at the bedside previously.
And a lot of nurses have that bedside, experience and exposure. How does that translate into the relationship building that then transfers into this role as a CDS? And how do you foster that partnership with providers and internal folks to make sure that we're moving to a best practice model?
Sure. I think it's just a different part of the care continuum for that patient. So as a bedside nurse, you would be the one that the provider went to see what was going on with the patient that day. So this is just a different facet of the same capacity. A provider will come and say, or in turn, a CDS specialist will go to the provider and say, I see you're treating the patient for X, Y, and Z, or you're documenting this. Can we help further specify that to make sure we're capturing what's really happening with that patient? And so that just builds that relationship with the providers, and as well as case managers, the other nurses on the floor, dietitians, those all really play into who we ultimately work with.
Well, I think that's helpful in kind of understanding that transition, right, from the bedside to a CDS role. As a nurse, you are a nurse, right? Clinician by experience and by background. Do you feel like any less of a nurse doing this type of work that is different from clinical bedside care?
Sure.
And can you explain your own journey around that?
Yeah, absolutely. This is certainly something that I have come to question or ask myself throughout my nursing career. When one asks what you do for a living and you say you're a nurse, your first thought is that bedside,
right there,
hands on the patient type of thing. Throughout my nursing career, I've learned that there are so many different areas of nursing that a nurse can work in, whether hands on the patient or behind the scenes. The end goal of a nurse is the ultimate care of that patient, and that doesn't change regardless of the capacity that you work in. So I think, again, in fruition of my career, I've come to realize I am still a nurse. I will always be a nurse, and that will never change.
Right, absolutely. How do you still apply your nursing skills, right? So you've been trained, you've gone through this arduous education and training program to get the credentials of an RN. How do you keep your skill set sharp, right, in this world doing the clinical documentation improvement work?
Sure. I think our team has a better opportunity to be able to sharpen those skills than we previously did at the bedside. To explain that a little bit further, at the bedside, it's really quick. You want to fix, stabilize, treat the wounds, move on to the next step. In this capacity, you really have time to really get into the full care of what's going on with that patient. It's not just about my 12-hour shift when I'm at that bedside, but how did the patient present? What critical thinking skills can I utilize in researching the patient that I can then have a conversation with the provider to make sure we're capturing the severity of illness of how that patient actually presents and ends up in the facilities.
Still telling that full story, right? That
Absolutely.
full clinical encounter event. Absolutely. What would you say are some nursing skill sets that you've acquired making the journey from bedside care to this space that you continue to hone in on?
Sure. So I think a piece of that is the relationships with the provider themselves. So again, talking about the continuation of the care continuum, it's a different capacity. It's a more professional relationship with that provider to understand the back end impact that his or her documentation has on that record, which in turn then lends to additional technology that's available to the facilities, additional resources as far as nursing personnel or caregivers that are within the facilities and those sorts of things. So it's really partnering in a different way with the providers to make sure we're showing that whole picture of the patient that presents.
Absolutely. You touched on technology. So we're all in revenue cycle. Technology is critically important to all of us. Can you talk about some of the technology that you have to use in this space? One, to maybe stay updated and educated. I know education is super important, but what does technology look like in this world for you?
Sure, and I think regardless of what capacity you work in healthcare, I think it would be similar across the board. So you talk about artificial intelligence, so screening through the records and kind of pulling out those key pieces that documentation specialists may need to then work with that provider on his or her documentation. Prioritization, so really kind of honing in on what's shown on our work lists with our list of patients that we have to go through for the day, and being able to prioritize what has the most opportunity and that we need to see kind of first is really helpful. Again, then pulling out those metrics. How can we then show the engagement that we're working with those providers on and in turn pull that information out of the software that we use and extrapolate that information to make us a better department.
And where do you see CDI going in the future?
There's so many different avenues that CDI can take. Right now, we are currently just in the inpatient adult world. But is there an opportunity to move into the pediatric space or the outpatient space, and how will that look like, and what does that mean for our teams? What does that mean for the clients that we serve as well, in order to, again, showcase the care that's being provided to a patient, regardless of what level of care in a facility they're in.
Sure, absolutely. And if we have, folks watching us today and are thinking about, how can I improve my program, what would you say to them in terms of what Ensemble can bring to the table?
I think the collaboration between the different departments. It's not just one department within revenue cycle that makes or breaks it. It's the culmination of all of those departments together. We certainly bleed into many different areas, not only the revenue cycle space, but on the clinical side as well. So again, working with the providers, the C-suites at the facilities, as well as the all other ancillary departments that we can help improve on.
And if we have a nurse maybe who's watching us today and thinking about, where they're at in their career development, what is some things you would recommend for that person to learn more about, either at Ensemble or just in this CDI space, that you would recommend for them to progress their career?
Absolutely. I think really understanding disease processes and making sure that you want to continue that knowledge base is first and foremost very important. Also getting out there and seeing what clinical documentation improvement is, and understanding the definition that we kind of highlighted at the beginning of our conversation. And then wanting to then kind of move forward and ultimately helping the provider showcase, as well as facilities be able to showcase how truly sick their patients are. So again, it's not being at the bedside and fixing and stabilizing right away. It's a much different process, but you get to use your brain so much more, and that's super exciting, being able to investigate the charts.
And what professional organizations should someone kind of look into that would help guide them in terms of, is this a career path for them that you would suggest? Sure.
I think the biggest one is ACDIS, ACDIS, which is the Association of Clinical Documentation Improvement Specialists. They offer a wealth of information, and you can get what a CDI specialist actually does, as well as certification. So it's a nationally recognized organization that you can become certified in to really showcase how your role in the healthcare organization.
Their overall impact.
Yep.
Thank you, Allison, for joining us today.
Thank you, Julie.
And be on the lookout for more operator insights.